Instructions for the proper preparation, reconstitution, and administration of Thyrogen. Thyrotropin alpha for injection, 0.9 milligrams IM. Thyrogen is a lyophilized powder containing 1.1 milligrams of thyrotropin alpha for single use after reconstitution with sterile water for injection. Thyrogen is supplied in a kit containing 2 vials of lyophilized thyrotropin alpha. Thyrogen should be used by physicians knowledgeable in the management of patients with thyroid cancer. Thyrogen preparation. Prior to Thyrogen preparation, confirm with your patient that 2 consecutive days are required to receive Thyrogen therapy. Confirming the appointment prior to preparation reduces wastage. Remove Thyrogen from the refrigerator several minutes prior to administration for patient comfort. Locate and check the expiration date to confirm the expiration date has not passed. Thyrogen reconstitution. To begin reconstitution of Thyrogen, add 1.2 milliliters of sterile water for injection to the vial containing Thyrogen lyophilized powder. Reconstitute immediately prior to use. The reconstituted solution must be injected within 3 hours unless refrigerated. If necessary, the reconstituted solution can be stored for up to 24 hours at a temperature between 36 degrees Fahrenheit and 46 degrees Fahrenheit while avoiding microbial contamination. Protect from light. Swirl the contents of the vial until all the material is dissolved. Do not shake the solution. Visually inspect the reconstituted solution for particulate matter and discoloration prior to administration. Thyrogen administration. To administer Thyrogen, withdraw 1 milliliter of the reconstituted Thyrogen solution, which contains 0.9 milligrams of thyrotropin alpha, and inject intramuscularly in the buttocks. Thyrogen should be administered intramuscularly only in the buttock. Consider alternating right and left buttocks so the patient doesn't receive the second injection on the same location. Record Thyrogen injection in patient chart. Discard unused portions. Do not mix with other substances. There are 2 protocols to follow regarding Thyrogen injection: Diagnostic and Ablation. The following protocol is recommended for diagnostic testing with Thyrogen. Day 1 and 2, 0.9 milligrams IM Thyrogen, dose once daily dosing for 2 doses, days 1 and 2. Day 3, if performing a whole body scan, WBS, 4 millicurie of radioiodine I-131 is given on day 3, 24 hours after the last Thyrogen injection. Day 5, serum TG is measured on day 5, 72 hours after the last Thyrogen injection, when average TG levels peak. Whole body scan is performed on day 5, 72 hours after second Thyrogen injection. Whole body scan should be acquired for at least 30 minutes and/or should contain greater than or equal to 140,000 counts. The following protocol is recommended for ablation with Thyrogen. Day 1 and 2, 0.9 milligrams IM Thyrogen, dose once daily dosing for 2 doses, days 1 and 2. Day 3, for remnant ablation with Thyrogen, radioiodine I-131 is given on day 3, 24 hours after the last Thyrogen injection. The dose of radioiodine I-131 is selected at the discretion of the physician. Day 6 through 10, a post-ablation scan should be performed 3 to 7 days after the administration of radioiodine I-131. Pretreatment with glucocorticoids should be considered for patients in whom tumor expansion may compromise vital anatomic structures. For more information on Thyrogen, please call Sanofi Genzyme at 800-745-4447, option 2, Monday through Friday, 8 o'clock a.m. to 6 o'clock p.m. Eastern Standard Time. To order Thyrogen, Sanofi Genzyme offers 3 options. Thyrogen can be purchased directly from Sanofi Genzyme by contacting Sanofi Genzyme's account business manager at 617-768-6846. When you buy Thyrogen directly from Sanofi Genzyme, your office will enjoy personalized service, free FedEx priority service, and order tracking support. To order Thyrogen through a specialty pharmacy, contact a Thyrogen One case manager at 1-888-497-6436. Thyrogen One is a support program that can help you verify your patient's insurance coverage and work with your patient's specialty pharmacy to help you obtain Thyrogen. For information to purchase Thyrogen through a wholesaler, contact your preferred wholesaler for details. Please Please note, sterile water for injection may be ordered from a medical supply provider, your specialty pharmacy, or distributor. If ordering through Thyrogen 1, the Thyrogen prescription order form includes a request for sterilized water. Thyrogen thyrotropin alpha for injection, 0.9 mg per milliliter after reconstitution. Important safety information. Warnings and precautions. There have been reports of death in non-thyroidectomized patients and in patients with distant metastatic thyroid cancer, in which events leading to death occurred within 24 hours after administration of Thyrogen. There are post-marketing reports of stroke in young women with risk factors for stroke, and neurological findings suggestive of stroke, for example unilateral weakness, occurring within 72 hours of Thyrogen administration in patients without known central nervous system metastases. Sudden, rapid, and painful enlargement of residual thyroid tissue or distant metastases can occur following treatment with Thyrogen. Pre-treatment with glucocorticoid should be considered for patients in whom tumor expansion may compromise vital anatomic structures. Patients should be well hydrated prior to treatment with Thyrogen. Caution should be exercised in patients who have substantial thyroid tissue still in situ or functional thyroid cancer metastases, specifically in the elderly and those with a known history of heart disease. Hospitalization for administration of Thyrogen and post-administration observation in patients at risk should be considered. Adverse reactions. The most common adverse reactions reported in clinical trials were nausea and headache. Use in specific populations. Pregnancy Category C. Animal reproduction studies have not been conducted with Thyrogen. It is also not known whether Thyrogen can cause fetal harm when administered to a pregnant woman or can affect reproductive capacity. Thyrogen should be given to a pregnant woman only if clearly needed. Nursing mothers. It is not known whether the drug is excreted in human milk. Because many drugs are excreted in human milk, caution should be exercised when Thyrogen is administered to a nursing woman. Pediatric use. Safety and effectiveness in pediatric patients have not been established. Geriatric use. Results from controlled trials do not indicate a difference in the safety and efficacy of Thyrogen between adult patients less than 65 years and those over 65 years of age. Renal impairment. Elimination of Thyrogen is significantly lower in dialysis-dependent end-stage renal disease patients, resulting in prolonged elevation of TSH levels. Indications and usage. Thyrogen is a thyroid-stimulating hormone indicated for diagnostic, use as an adjunctive diagnostic tool for serum thyroglobulin TG testing, with or without radioiodine imaging, in the follow-up of patients with well-differentiated thyroid cancer who have previously undergone thyroidectomy. Limitations of use. Thyrogen-stimulated TG levels are generally lower than and do not correlate with TG levels after thyroid hormone withdrawal. Even when Thyrogen TG testing is performed in combination with radioiodine imaging, there remains a risk of missing a diagnosis of thyroid cancer or underestimating the extent of disease. Anti-TG antibodies may confound the TG assay and render TG levels uninterpretable. Ablation. Use as an adjunctive treatment for radioiodine ablation of thyroid tissue remnants in patients who have undergone a near-total or total thyroidectomy for well-differentiated thyroid cancer, and who do not have evidence of distant metastatic thyroid cancer. Limitations of use. The effect of Thyrogen on long-term thyroid cancer outcomes has not been determined. Visit www.thyrogen.com for full prescribing information.